Welcome to Plastic Surgery Talk with Dr. Stephen Mulholland, brought to you by SpaMedica. Hello and welcome, Dr. Stephen Mulholland here in Toronto, Canada. Welcome to Plastic Surgery Talk and another installment of our podcast series. This podcast is an interesting topic. It's on the use of nitrous oxide in aesthetic medicine. Really, it could be about how to manage pain successfully, pain, not paying, P-A-I-N, pain, patient discomfort in the outpatient aesthetic setting optimally. So do you have a lot of word-of-mouth referral for comfortable treatments and recurring revenue? So today's podcast is on nitrous oxide. PRO-NOX specifically was one of the biggest vendors in the US and in North America for outpatient clinic nitrous oxide. There's also Nitrous and some other vendors as well. So laughing gas, nitrous oxide, and its use in aesthetic medicine. If you find these podcasts entertaining, educational, informative, please share them, sign up, and comment. So what is PRO-NOX? PRO-NOX is a manufacturing trade name for nitrous oxide or laughing gas. Laughing gas has been around in dentistry for 30 years. So they cause a lot of pain, dentists. Everybody doesn't like a dentist, and so you don't want to be viewed as a dentist. You're an aesthetic physician, aesthetic technician. You want people to tell their friends that it was a painless experience, that tattoo removal or that energy-based device or that injectable. And so the use of laughing gas has been one of the most important additions to my business and my practice I think I've made in many, many years. So PRO-NOX is laughing gas. Laughing gas is nitrous oxide. Nitrous oxide helps minimize the perception of patient discomfort during an aesthetic treatment. So how does nitrous oxide or PRO-NOX laughing gas work? Quite simple. You know, nitrogen is about 9% of the atmosphere that we breathe in every day. When we increase the percentage of nitrogen in our inspiratory gases, in this case we're talking 50% nitrous oxide. Many dental components and systems use up to 80%. At 80%, nitrous oxide becomes an anesthesia. And there are regulatory issues around that, particularly in my practice and your practice. The PRO-NOX that I'm advocating, the nitrous oxide or laughing gas content mixture, is 50%, 50. At 50%, it's considered an analgesic. And depending on the state, and virtually every state and province are the same, you can legally drive after 8 to 10 minutes of PRO-NOX or nitrous oxide. So how does nitrous oxide work? You increase the percent of inspiratory gas to about 50%. After about 6 to 8 breaths, or 1 minute, and as a deep breath, hold it, and then breathe out. So slow, deep breaths. After 6 to 8 deep breaths, it releases, the nitrous oxide goes from the lung into the bloodstream to the brain, and it releases a sudden surge of endorphins. These are the chemical neurotransmitters in your brain of well-being. The two neurotransmitters that are released a tremendous surge of well-being are serotonin and dopamine. So this surge of well-being, of euphoria, washes over the patient whilst they're getting an energy-based treatment like tattoo removal or laser resurfacing or laser hair removal or botox or filler or your pre-freezing prior to a surgical treatment. These experiences then, which are viewed as painful by the hypothalamus, they get corticated, the higher brain, with all the serotonin and dopamine goes, be quiet, hypothalamus, I can hear this pain, I know it's there, I hear you, but I don't care. So it creates a disassociation, a euphoria, a sense of well-being during discomfort. And it's a very pleasant experience for patients who otherwise would be in a significant amount of discomfort in a lot of cases. And so it induces a chemical release of natural neurotransmitters of well-being, serotonin and dopamine. That's what nitrous oxide does. And the beautiful thing about it, once you stop inspiring or breathing in the nitrous oxide, within about 8 minutes, the effect is washed out, patients are back to their baseline, and they can drive home. So who's a good candidate for PRO-NOX, for laughing gas, for nitrous oxide during a procedure? Well, any patient coming into your clinic who's medically well, who has no signs or symptoms of metabolic diseases that are uncontrolled, like liver failure or heart diseases or uncontrolled respiratory illnesses, medical illnesses that would not make them a great candidate for cosmetic treatment in the beginning. So medically well patients who are having what is an uncomfortable or painful procedure, injectables are common, energy-based device are common, freezing for a local anesthesia facelift or liposuction, common indications for modulation of pain. And they understand that there are slight risks and side effects to nitrous oxide, but not many. These are the great candidates, those that are going to have a procedure that has some degree of discomfort, and you want to take that discomfort and make it a pleasant experience. I call it fun pain. Turning the procedure into fun pain through the use of nitrous oxide, that's a good candidate. So how's PRO-NOX nitrous oxide administered? Well, it comes in a very convenient carrying module on wheels. So a tiny module with two little canisters. It's a mixture of oxygen and nitrous oxide, 50-50 mixture of 50% oxygen, 50% nitrous oxide. The suppliers of these medical gases are medical gas supplier companies, and those are available in every market. They come in small sizes that slide nicely into the little portable unit on wheels. The regulators hook into to a modulator that creates flow, and then the patient simply breathes through a one-way tubing or obturator, so sort of like they're snorkeling and they're swimming in the water. They breathe in and out through the same tube. There's the white intake tube, the pink exhalation tubing. The exhalation tubing goes to the floor or a scavenger, so there's no risk of nitrous oxide to the staff or the surrounding ambient region. So it's in a very portable unit. There's two mechanisms for inspiration: a mask, which the patient could use if they're having a body procedure, let's say liposuction, or a body procedure where local anesthetic is being required, or they're having a body laser procedure, like an energy-based device or a fractional technology. And so what are the procedures you can use this? Well, let's divide them into injectables and non-injectables. Injectables, botox, soft tissue fillers, sculptura, any kind of injection technique. It's great for that. Nitrous oxide, laughing gas as an outpatient, PRO-NOX is great for injectables. Energy-based devices, lasers, radio frequency devices, laser resurfacing with fractional technology like fractional CO2 or fractional RF with high fluence, that can be uncomfortable, and PRO-NOX or nitrous oxide is perfect for that. Energy-based devices such as laser hair removal, there can be a real snap or sting to laser hair removal that some patients find uncomfortable. PRO-NOX or nitrous oxide laughing gas is perfect for that. Energy-based devices such as laser hair removal, that can be snappy or uncomfortable, and it works beautifully for that. Fat destruction through thermal technology such as sculpture is good for that energy-based device. So any energy-based device in your practice that has discomfort associated with it, or local anesthesia leading up to it, such as the Mira Dry, which is a microwave used to ablate excess sweating. There's local anesthesia for that. Nitrous oxide will decrease the discomfort of the local anesthesia. So energy-based devices, injectables, and leading up to and during a surgical procedure into local, those are the main indications and procedures during which I've found the use of nitrous oxide or laughing gas to be invaluable in modulating patient discomfort and making the procedure fun. What are the benefits of PRO-NOX or nitrous oxide? Well, there's two benefits. One is to the patient and two is to the practice. First, the patient's perception is one of euphoria, one of well-being in the face of pain, which is an odd sensation. They feel not altered consciousness as in they've been smoking marijuana or some substance that changes cognition. They feel euphoria and well-being, but it's their same brain. They just feel separated from the pain. The pain is over here, the hypothalamus. They're thinking about the pain or other things, and it's separated from the pain. So it's a sense of well-being in the presence of disassociated pain. And so an uncomfortable procedure that might be ranked as a 7 or 8 out of 10 by the patient will be ranked a 2 or 3 when they take nitrous oxide. And so the benefit is the patient's perception. Very few side effects. Patients can drive home right away, and there's really no contraindications in essence. The benefits to the practice are huge. Number one, patients find that your technique is painless, and they tell patients. So more word-of-mouth referrals from patients who are telling other patients the use of this PRO-NOX, or this laughing gas, was an awesome addition to the experience of discomfort, making you the provider they want to see. So word-of-mouth referral, retention, patients are more likely to come back for an uncomfortable procedure like mirror drag, where they need 2 treatments, or subsequent laser tattoo removal treatments, or fractional treatments, ongoing maintenance injectables, when the fear of the pain or the anxiety, anticipation of pain is removed. So patient variables, better experience; practice variables, better outcomes in terms of perception of discomfort, and better retention and referral ambassadorship when you are the painless practice. So PRO-NOX sounds great, this laughing gas sounds great, but are there any side effects or risks that we got to know about? Well, there are some rare syndromes, particularly with liver metabolism, where if they're in fulminant liver failure insufficiency, or they have a pulmonary disease such as cystic fibrosis or COPD, they're not great candidates for treatment anyway, and you might want to avoid an inhalation like nitrous oxide. But virtually every healthy, well, cosmetic medicine patient is a candidate for nitrous oxide. What are some of the side effects? In rare instances, perhaps 1 in 20 or 5%, patients will experience a little lightheadedness, perhaps a little nausea. They might get a bit of vasovagal from the experience of the nitrous oxide, and that might actually be related to the injectable anyway. But those that are purported side effects, and generally you remove the nitrous oxide, bring the legs up, head back, cool compresses, and the sense of nausea or lightheadedness tends to dissipate as they wash out the nitrous oxide in 6 to 8 minutes. So some limited side effects that generally are self-limiting and go away as the nitrous oxide washes away. And in my experience, it's probably even less than 1 in 20 or less than 5%. Virtually everybody finds it an enjoyable experience. Sometimes it can be very powerful, and patients exercise what I call self-administered PRO-NOX. They take a few breaths, remove it, and they can take another puff or two when whatever I'm doing gets uncomfortable again. So it's titrated to patient levels of euphoria and well-being. You don't have to force them to breathe the nitrous oxide through the entire procedure. Self-directed, patient-administered helps minimize over nitrous oxiding the brain, creating too much euphoria and the side effects that can occur. So what is the cost of PRO-NOX to you, the patient who's getting this treatment? And different physician practices do different things with this. Some just include it as part of the treatment. Generally, these tend to be practices that are generally more expensive. They're charging more because they perhaps have a better or a more expensive reputation in the market, and you'll find that the cost of the PRO-NOX is part of the treatment. Some practices prefer to break out the cost of the PRO-NOX, and so there'll be cost of the treatment, whether it be botox or soft tissue filler or laser hair removal or a pico, sure pico way and light and picosecond laser tattoo removal or a fractional laser resurfacing. There's the cost of the procedure, and some practices break down the items of the cost associated with the treatment. They might charge you for the topical anesthesia. They might charge you for the PRO-NOX individually. Most practices charge between $50 and $70 per treatment for the analgesic effect of the PRO-NOX. So about $50 US, different if you're a non-US market for PRO-NOX, as an additional cost to the treatment. And you as the consumer can decide, you know what, that $50 for the pain relief was more than worth it. And again, some practices with higher price points for their procedures will tend to bundle it within the treatment itself. So you can see either way, paying per treatment, in addition to the treatment service fee, or rolled into the treatment service fee. Both models are acceptable, and it depends on the practice that you pick. So when sourcing out a physician, what do you look for, a clinic or provider? Well, you want to make sure they have a great reputation for whatever you're doing, whatever injectable you're doing, botox, filler, or energy-based device treatment. laser hair removal, tattoo removal, fracture resurfacing, any cosmetic surgery procedure, a liposuction physician, facelift surgeon. Make sure they're good at what they do. And then, of course, they modulate and cover off on pain and discomfort. And the more modern and up-to-date practices can be incorporating nitrous oxide increasingly. I've done it for quite a long time, and it has become a mainstay, an addition to local anesthesia for discomfort. Make sure that PRO-NOX is part of their treatment offering, or call the clinic. If you know your doctor well, reach out to them and ask them, why haven't they included nitrous oxide into the management of discomfort? You've read online that this is a great technique, and I think you can help them, they might not even know about it, help them bring something great into their practice. So research your physician or provider on the basis of their quality, skills, outcome, before and after, a photo gallery, lots of testimonials, no medical malpractice lawsuits, litigation, and of course, their approach to pain and discomfort. And hopefully nitrous oxide, PRO-NOX, laughing gas is a part of that equation. So thank you for joining me again, Dr. Stephen Mulholland here in Toronto, Canada on Plastic Surgery Talk for another installment of our podcast series. This was on laughing gas, nitrous oxide, PRO-NOX, the largest brand name, and how we have incorporated that into our aesthetic practice and how you, the consumer, can benefit hugely from the perception of discomfort. You can create fun pain during those treatments and services that right now may be uncomfortable. You can render them, dare I say, enjoyable, a fun pain, a fun experience, a way to modulate discomfort in the name of aesthetic beauty and enhancement. If you've enjoyed these podcasts, this one in particular, please share, sign up, and comment.